Welcome back, everybody. I hope you had a nice break. My name is Bryce McKibben, and I'm Senior Director of Policy and Advocacy at the Hope Center. I use he, him pronouns. And we are really happy for you to be able to join us in this incredibly timely session on supporting reproductive justice for students in higher education. After the Supreme Court's devastating Dobbs decision earlier this summer, attacking long-held rights on abortion care, the Hope Center issued a statement affirming that access to abortion is not only a matter of healthcare, it is a student basic need, and it will have a significant impact on all students who can become pregnant, as well as their family and their support network. The court's decision affects the rights and lives of all students, including trans and non-binary people who can become pregnant, and those who identify as men who are parenting students. But the impacts will be felt most deeply by historically and systemically marginalized people. While students are just trying to focus on their coursework and be successful, they now have to contend and confront forced birth laws in place or about to go into effect in states across the country, and even last week being reintroduced at the federal level. But thankfully, many policymakers are fighting back. And today we have an incredible panel of federal and state officials and advocates here to talk about ways that we can support reproductive justice for students in higher education. First up, we have Lauren G., Chief of Staff for the Office of Civil Rights at the U.S. Department of Health and Human Services. This office, as she will explain, is on the front lines of protecting right to health care for individuals across the country. And HHS is currently leading a task force on abortion rights that was formed by President Biden by executive order this summer. Lauren previously had extensive service in the U.S. Senate. Second, we have Laurel Sakai, National Director of Public Policy at Planned Parenthood Federation of America. Many of you are undoubtedly familiar with Planned Parenthood's fight for abortion rights and reproductive health, but Laurel's also a former colleague of mine on the Senate Health, Education, Labor, and Pensions Committee and has a wealth of experience on Capitol Hill. Welcome, Laurel. It is good to see you again. Next, we have Senator Connie Leyva, who represents California's 20th Legislative District. Senator Leyva authored and passed Senate Bill 24 late in 2019, which starting this coming January requires all University of California and California State University campuses to provide medication abortion, also known as the abortion pill. Mifepristone and misoprostol are easily obtained via healthcare clinics or potentially via telehealth at these campuses once implemented. It is currently rare at most colleges across the country for students to be able to access abortion care. And few in states that are limiting access to abortion are willing to discuss publicly whether they will even help students with the travel costs they need to seek the health care that they need. We look forward to hearing from Senator Leyva about the important law she established in California and how it can serve as a model for other states. Welcome, Senator. And last but not least, we have Cindy Cruz, Western States Program Director for Unite for Reproductive and Gender Equity, or URGE. Cindy is working on implementation of California Senate Bill 24, which I just discussed. Prior to joining URGE, Cindy was the Director of Education for Planned Parenthood California Central Coast, where she oversaw the delivery, implementation, and evaluation of the organization's sex education programming. Cindy is a certified health specialist, and she holds a Master of Public Health from California State University, Northridge. Welcome, Cindy. Before we begin and kick it over to our panelists, I did want to note that the Q&A or chat feature is open during this session on the main page, but again, a reminder that we may not be able to get all of your questions, though please feel free to engage with this tremendous community and place your most burning questions in the chat. Thank you so much. And we'll begin with you, Lauren.
Thank you so much, Bryce, and thank you to the Hope Center for having me today. First, I want to say that I'm from Mississippi, which has been a battleground for taking away access to women's reproductive rights. So to be here today working on this issue that is very close to my heart really means a lot that I get to have that opportunity to speak. I'm so glad that y'all who are joining us today recognize the importance of the new landscape in women's healthcare. We are in a time where there are real threats to reproductive rights, bodily autonomy, the right to emergency and life-saving care, and the right to privacy. As the Chief of Staff at the Office for Civil Rights at the Department of Health and Human Services, I work with my teams to enforce federal civil rights and privacy protections. So when I say that, what does that look like? When I say civil rights protections, OCR enforces laws against discrimination on the basis of race, color, national origin, disability, age, sex, and religion by certain healthcare and human service providers, as well as insurance plans. What that looks like is a physician hospital insurance plan cannot deny you based on these things. Everyone has a right to access healthcare that is free from discrimination. When I say we enforce privacy protections, I'm talking about our authority under the HIPAA privacy rule and how we protect an individual's protected health information, making sure that information isn't disclosed if not permitted, and also ensuring patients have access to their medical information. So how do we do these things? So really, the Office for Civil Rights is a law enforcement agency. We can initiate investigations when we see reports of discrimination, privacy violations. We can also investigate complaints that we receive from the public. We also do rulemaking, which means we have a deliberative process for developing and implementing protections, as well as giving assistance to entities to help make sure that they're following the law. So today, I've been asked to cover some of the actions that the federal government has taken to help protect access to reproductive health care. As you know, for nearly 50 years, women in America lived in a country that provided a constitutional guarantee to freedom, privacy, and autonomy to control their own bodies. But on June 24th, 2022, the Supreme Court changed all of that. And so we at HHS, under the direction of President Biden, are working very quickly to come up with actions to help as many people across the country who on that day lost their constitutional rights. Some of the actions that we've taken by OCR I'll cover today. And because our federal civil rights and privacy laws play such an important role, OCR at HHS is really at the center of this work. For example, after the Dobbs decision, OCR took several actions to remind folks of their obligations under the federal civil rights and privacy laws. We're also reminding consumers and patients of their protection under the law. Some of the things we heard right after the Dobbs decision were about concerns with patient privacy and how folks were accessing records or doing smartphone apps, and how people were finding geolocation and with like period tracking apps. So in response to this, we wanted to make sure that we reminded HIPAA covered entities and business associates that they can disclose PHI only under certain circumstances and when they're permitted or required by the privacy rule. For example, our guidance also explains that the privacy rule's restrictions on disclosure of PHI when required by law for law enforcement purposes can only be done under circumstances and when there's actually like a law document, like a subpoena or a court order or a warrant. Even then, health providers are permitted to disclose that information, but are not required by the HIPAA privacy rule. In addition, like I said, we heard concerns about smartphone apps, tracking personal health data, and how this information could be used to target persons who may be seeking an abortion or other reproductive care. So we put out guidance that explains that although the HIPAA rules generally do not protect the privacy of individuals when that information is downloaded to a smartphone and tablet, we did give out best practices for how consumers can decrease their presence online by taking certain steps on their cell phone, so they're maybe not as tracked, et cetera. One of the other things that we had been hearing about is that we were hearing that folks weren't able to get the necessary medications. And so we wanted to make sure that pharmacies understood that they had obligations under federal civil rights laws. There's about 60,000 retail pharmacies nationwide. The guidance that we put out is more like technical assistance to tell pharmacies that, hey, these are your civil rights obligations under existing law, and this is how we expect you to meet them. And when I think about pharmacies, we're talking about pharmacies who receive federal financial assistance. So that includes folks who have Medicare or Medicaid payments. These pharmacies are prohibited from discriminating, again, on the basis of race, color, national origin, sex, age, and disability. Lastly, we put out a proposed rule that we're super proud about. It's to strengthen non-discrimination in healthcare. So when I say that, what I'm referring to is Section 1557 of the Affordable Care Act. This prohibits, again, discrimination on the basis of race, color, national origin, sex, age, and disability. And this proposed rule is new in that it affirms protections against discrimination on the basis of sex and reiterates protections from discrimination for seeking, it reiterates protections from discrimination for seeking reproductive healthcare services. So it makes clear that discrimination on the basis of sex, which includes discrimination on the basis of pregnancy or related conditions, is not allowed. Now, I know that later today we'll have a Q&A and we'll talk about what kind of actions the federal government is considering and looking at. I want you to know that we're still evaluating actions in the states. We're watching closely how healthcare providers, pharmacists, and other healthcare systems are responding to this Dobbs decision. And I want to let you know that there is a lot that you can also do. One of the things to do is you can share your experience with the proposed NPRM that we have posted for Section 1557. You can actually comment on this rule, which is helpful to us to know that what your thoughts are and what your challenges are in some of these non-discrimination in order to protect and strengthen non-discrimination. You can also file complaints with the Office for Civil Rights on our website to make sure that we know that your civil rights or privacy protections are being violated. And then we would follow up and investigate those complaints. So I'm excited to be here again today, and I look forward to the questions that you have later.
Thank you, Lauren, and over to you, Laurel.
Hi, everyone. As Bryce said earlier, I'm Laurel Sakai. I'm the National Director of Public Policy for Planned Parenthood Federation of America, and a former colleague of Bryce and also a former colleague of Lauren G's. So it's really great to have this little reunion for me personally. But do want to just reiterate that I am very grateful to Bryce and to the Hope Center for hosting this panel and for inviting me to speak on it. It's such an important topic to be talking about, and thank you all for taking the time. I know there are different sessions that you could choose to participate in, and it's really great to see that there are so many folks that are interested in this topic as well. We are certainly in a crisis moment when it comes to reproductive rights in this country. The Dobbs decision that Bryce mentioned earlier marks the first time that the Supreme Court has taken away a constitutional right, and since then we have seen 17 states, the most recent of which was just yesterday in Indiana, have abortion bans go into place. So for the last few months, my organization has been working with our affiliates and stakeholder partners on the federal, state, and local levels to react to a really ever-changing legal environment. I certainly won't pretend to have all the answers of what can be done on this call today, but I am really excited about the opportunity to speak with you all, and especially, really excited for the question and answer portion. It would be great from my perspective to, if there's anything that you all are experiencing. I know there's folks from, different parts of the community. There's students on, there's administrators, there's state and local regulators. I know there's sort of a lot of things that people are experiencing. So as we are trying to respond on all levels, it is really great to hear from folks on the ground about how this is impacting them. So for some additional background, I work primarily on the federal policy team. So we work really closely with Lauren and the people in her office about what opportunities there are for the federal government to act on, particularly when it comes to harm mitigation. As many of you probably know, there are federal funding restrictions that are often referred to as the Hyde Amendment that prevent the federal government from being able to directly fund abortion care in most circumstances. So we certainly recognize that limitation on, Lauren and her colleagues, but that doesn't mean that there's nothing the federal government can do here. So we've really been working on what the administration can do as a part of what has been outlined as its whole of government response. So I just wanted to follow up a little bit on some of the things that Lauren mentioned. So in particular, the data privacy and healthcare records. I think as over the past few months, we've certainly heard people talking about the concept of going back to the days before Roe, which in many ways is true, but in the 1970s, we didn't have little computers in our pockets following us around and knowing where everyone was. So the data privacy protections that she's talking about are super important, and we've been working really closely with a number of federal stakeholders as well as others to try to make sure that people's privacy is as protected as it possibly can be. And Laura mentioned in particular the work of the HHS OCR, which I know for a number of you in the education space, when you think of OCR, you probably think a lot more of the Department of Ed side, which has slightly different responsibilities and roles here. We have seen, the Secretary of Education very involved in this as well. There was a meeting, I believe, in July that was convened by the Vice President and as well as many stakeholders in the education space. So we're really glad to see efforts from the Department of Ed as well. One place where we have been hoping to see more coordination between HHS OCR and Department of Ed is when it comes to the intersection of the HIPAA and FERPA guidance. This is an area that has a number of challenges, but in particular right now, when you have students who may be getting their healthcare through their schools in some way, making sure that they understand what is and is not protected and by whom is really important. And to Lauren's point on the OCR enforcement actions, I do just want to also point out that historically, HHS OCR has been pretty underfunded when it comes to the folks who are on the ground who are responding to those complaints that are put out there. So that's certainly a place that we are looking for additional funding for OCR to be able to respond more rapidly and to take, rapid actions against people who are discriminating and preventing healthcare from happening. And so I'm just scrolling through my notes. The other topic that I want to touch on is the Title IX draft rule that was proposed earlier this week. And just to connect a few dots so folks are aware, the rule that Laura mentioned, the 1557 rule, which is primarily thought of as a healthcare rule, the non-discrimination protections in there when it comes to sex actually do link up and are based on the Title IX protections themselves, but do not incorporate in the Title IX limitations when it comes to abortion. So it's definitely an interesting intersection to especially think about how these federal non-discrimination laws all work together. But for the purposes of Title IX, Planned Parenthood did comment on those proposed rules. We are generally supportive of the efforts to protect against sex discrimination, including sex discrimination due to pregnancy outcomes, and sex stereotyping. We are particularly pleased to see the protections for pregnant and parenting students, which will continue to be a really important population to be mindful of. And then one of the places that we did ask the administration to go farther is to think about how schools that are located in banned states, abortion banned states, can take steps to make sure students aren't discriminated against as they seek healthcare. So are there more flexible policies they can have around travel, around leave, financial support for travel, things like that, to ensure that there's no discrimination that's happening? So there's just some of the big picture things that we're working on the federal level. Ultimately, the impacts of the fall of Roe are probably going to impact students, schools differently depending on which state that you're in. And so while we're doing a lot of federal advocacy, we do know that there is a lot of work happening on the state and local levels. It took, 50 years to undermine the federal protections for abortion. So we know it's a long fight to get back to putting those protections back in place and hopefully to have additional protections as well. But what we're seeing right now is a lot of energy on the ground. And a lot of that, from our perspective, is coming from the Planned Parenthood Generation Network, which has over 350 branches at schools across the country. We are seeing them now organizing on the grassroots level on their campus communities. So to the extent that there are folks that are interested in doing more, I really suggest reaching out to them to see what is happening there. And that work really looks different depending on where folks are. So for abortion safe states, providing medication abortion in campus health centers, which I believe you're going to hear more about from the speakers who are coming up. And then in abortion ban states, looking for more creative solutions, like I mentioned before, the flexible attendance policies, funding for travel, as well as access to free and reduced cost emergency contraception and at-home pregnancy tests. So there's a ton of work to be done. Like I said, I'm really grateful for everyone's interest in this topic and definitely excited to have the question and answer period. And I will turn it back to Bryce to introduce the next speaker.
Thank you, Laurel, and thank you both, Lauren and Laurel, for your wealth of knowledge on federal policy and what's coming up. And now we get the pleasure of transitioning over to the state side of the conversation. And it is, again, my honor to introduce Senator Leyva from California. Please take it away, Senator.
Thank you very much. Good morning, everyone. Thank you for having me. Thank you for doing this. As we know, this is just an incredible topic. Thank you to the previous speakers and all the work that they're doing at the federal level. As we all know, it doesn't need to be restated, but I will restate it. Reproductive health care is under attack across the nation. Never did I think at age 55 we would be relitigating what our grandmothers and great-grandmothers relitigated. To think that my daughters and granddaughter do not have access to the same and rights that I have had my whole life is really just shocking. But I feel lucky to live in California because we fundamentally believe that every person deserves the right to access abortion. And as many of you know, almost 3 years ago, the Governor Newsom, signed Senate Bill 24, the College Student Right to Access, the Student Right Access Act, which requires all on-campus student health centers at public universities in California to offer medication abortion by January 1, 2023. For those who are not familiar with it, medication abortion is a process where a patient uses 2 drugs, as you did hear earlier, over the course of 2 days during the first 10 weeks of pregnancy. Pregnancies are dated from the first day of the last menstrual cycle. Research shows that medication abortion is extremely safe, with major complications only occurring in 0.3% of cases, making it safer than Tylenol and Viagra, which I like to remind my male colleagues of many times while we were getting this bill to the finish line. As a point of reference, childbirth has a 14 times greater risk of death than an abortion. Medication abortion is a safe procedure and is clinically simpler than much of the care that is already offered at college student health care centers, such as diabetes management, mental health care, and the diagnosis and treatment of sexually transmitted infections. It is important that to not confuse the social complexities of abortion with the clinical simplicity of abortion. Though many California public universities already offer reproductive care services, such as pregnancy options, counseling, and contraceptives, at the time of this bill's passage, none offered medication abortion on campus. At the time I introduced the bill, abortion access was severely limited for college students, since only 15% of the closest off-campus abortion facilities were open on the weekends, meaning that students would have to miss class, exams, and work to access abortion. And it's these same students who brought this idea to us and asked us to do this. So like I always say, our future is bright with these young people that are at our campuses. Being able to access medication abortion on college campuses is critical, since pregnant people must receive this care within 10 weeks of being pregnant. And most people do not even know or find out that they're pregnant until the 5th or 6th week of their pregnancy. And we heard from so many students who said that they found out they were pregnant and could have accessed medication abortion, but because they couldn't access an abortion, by the time they got an appointment, they had to have a surgical abortion versus medication abortion. Being able to access medication abortion on college campuses is critical. It is unacceptable that here in California, as a national leader of abortion and reproductive health care, college students could walk into their campus health centers and get tested for an STI and get contraception, but they could not get a medicated abortion. Fortunately, that reality is changing, as several UC students' health centers have already begun providing medication abortion, and all UC and CSU student health centers, as I said earlier, have committed to providing on-site medication abortion by the end of the year, which puts them just a skosh ahead of the requirement because it is the law now. When we introduced this bill, we had absolutely no idea how incredibly important it would be in early 2017, because we had no idea that the Dobbs decision would be passed. So sometimes we do things, we know it's the right thing to do, but we have no idea it's going to have such a critical impact. But now we need to work extra hard to make sure that everyone has access to critical sexual and reproductive health care that they need. And for those of you who don't know, it took us almost 3 years to get this bill done. The first iteration, which was SB 320, was vetoed by Governor Brown, and Governor Newsom, who was the lieutenant governor at the time, publicly said, well, I wouldn't have vetoed that. So guess what? We reintroduced it the next year, and we reminded him that he said he would not veto it. And he did not. It got to his desk, and he signed it into law. In spite of the huge need, there is no doubt that the anti-abortion and gender slanderous rhetoric will continue in the weeks and months ahead. So it's incumbent upon all of us to make sure we provide accurate information, that we make sure that we let people know that you should always have a choice of when you decide to incorporate a family into your life. After all, barriers to abortion access disproportionately hurt young and low-income women of color, so we need to fight for them and everyone else who may not have a voice at the table or the ability to speak for themselves. As a woman and as a legislator, I deeply believe that each of us should have the right to our own life decisions. And I will say again that I cannot believe at 55 years old we have to do this because our rights are being challenged. But we will fight on, and we will always do what is right. And I thank you for having me. I look forward to any questions you might have. And I look forward to this bill going across the nation and making sure all students on all college campuses have access to medicated abortion. Thank you for having me, and thank you for what all of you do every day.
Thank you so much, Senator, and for your leadership in passing that important legislation. Cindy Cruz is up next. Welcome, Cindy.
Hi, everyone. Thank you, Bryce. Thank you, everyone, and the Hope Center for having me today. I'm so excited to be here with this fantastic panel. My name is Cindy. My pronouns are she and her, and I'm with URGE, Unite for Reproductive and Gender Equity. And I'm going to tell you a little bit about URGE and then the work that we're doing around the implementation of SB 24. My role at URGE, as I came in as director about a year ago, was really working with my team to work on the activism side. So I will definitely speak to you today about, what student activism is looking like around the implementation of Senate Bill 24 and the work that URGE has done to help with implementation. So there we go. Sorry, I'm struggling with my slides a little bit. So a little bit about URGE. URGE, we're a nonprofit organization, a reproductive justice organization that works specifically with young folks. URGE builds power and sustains a young people's movement for reproductive justice by really centering the leadership of young people of color who are women, queer, trans, non-binary, and people of low incomes. We are state-driven, meaning that we are not a national organization, but we focus specifically on 6 different states, which is Georgia, Alabama, Ohio, Kansas, Texas, and California. California being the state that we work with that is the most progressive. In many of our states, we are experiencing extreme challenges right now, given the state of where we are in our nation, as our previous speakers have mentioned. But those are the states that we focus in as an organization. So as after the implementation or after the bill passed, Senate Bill 24, URGE really felt that we had a unique opportunity to work with young people because it's important that young people's voices continue to be heard. As Senator Leyva mentioned, this push for medication abortion on college campuses was really started by young people and led by young people. And it's really their power that led to this huge win in California. And so for us, it was really important to continue to cultivate that and to make sure that young people's voices continue to be at the table when it comes to the implementation of the bill. Because as we know, passing legislation and implementation are 2 completely different things. And so like I said, we really feel that students had an important role to play when it came to the implementation of Senate Bill 24. And we felt that putting an advisory board together was going to be our best way forward in doing this work. I also want to say that like I mentioned, I came in with the implementation side, but we had a great team of organizers that really started this work. So I want to give them credit because they're the ones that really came up with the idea of the student advisory board and started this work, and I'm just continuing it on now. So we put together a pro-abortion student advisory board, which we also call the PASA board. And the PASA board is comprised of a select number of young folks from the UC, University of California, and the Cal State University systems. They are student leaders who really are working on the collective strategizing and also addressing the barriers that we're seeing come up as we're working on this implementation. And so they are really, this is their vision of what they would like medication abortion to look like on their college campus. And that's what we are working with them on at the moment. So we have a board of 13 students from across the state. They represent 9 different campuses across California, with our Cal State University system being represented a little bit stronger right now on our board because we knew that the Cal State University system was going to need a little bit more support when it came to the implementation of the bill. Now, while I am sharing our advocacy efforts, I do want to say that we are in coalition with a number of partners who are also working on the implementation of this bill. We have Essential Access Health, which has really focused on the training of providers at the student health centers, and they're working really closely with them. We have the California Commission on the Status of Women and Girls, who is dispersing the funds to the universities so that they can make sure that this implementation is happening. And as Senator Leyva mentioned, all of the universities are on track to implement by January 1st, 2023, which is really exciting. So our advocacy is really more on the experience of young people as they're coming into the student health centers, because we're really fortunate that all of the universities are on board and are set to implement by the 1st of next year, January 1st of next year. So some of the work that the PASA board did last year was really around trying to understand where students are at when it comes to the implementation of medication abortion on campus. We were interested in knowing if they even knew that this was a service that was going to be provided. We wanted to know how they felt, what was important to them, what were maybe some of their fears around the implementation, what were they excited about, and really what they needed when it came to ensuring that if they needed to access these services that they would. So we did a survey. We got some great feedback from folks. And so as you can see here on this slide, these are the things that came up. We had about 70 students from across the state respond. We know that that's small, and we continue to do this work to get more feedback from folks, but these are the things that came to the survey, the surface in that survey around what students really needed and wanted and were asking for. To no surprise to anybody, confidentiality is really, really important to folks as they're coming in to access services. They want to make sure that it's confidential and, if possible, anonymous, but definitely making sure that if they were accessing services that it was confidential, and that, no folks were not going to know about this, or that it was confidential as possible. Cost is a big concern for young people. That's something that we're working on a lot with our PASA board, is trying to understand what cost looks like. It's different for every university. It's different for every student health center. California has some really great programs in place when it comes to paying for medication abortion. We have our Family Pack program that's specifically for sexual and reproductive health care. We have our PE for PW program that can help folks who are pregnant or for folks who need abortion, but that has to be billed to Medi-Cal. Not all universities are on board right now with billing Medi-Cal, and so we know that some students are going to fall through the cracks and may need to pay for these services. And so what we're really working on right now is trying to build those relationships with student health centers to better understand what cost is going to look like, because we don't want it to cost folks anything, right? Because that's another barrier to access. And so we're working, it's not very clear, but we're working with the different campuses right now to look at what cost looks like and whether or not they're billing Medi-Cal, or if the campuses have funds to be able to help folks pay if they don't have insurance. So that is a big question for us right now. Language accessibility, also really important for our young people, making sure that information on medication abortion on campus is available in different languages so that folks can access it. And folks really wanted to know what medication abortion was and wanted to get a better understanding of how it works. And if they were to come into an appointment, what would that experience be like? So that is also something that we're working on. The next two bullet points is folks wanted the student health centers to be vocal about the fact that medication abortion was going to be available on campus. What we've seen right now is that this is not the case for every campus. And so, you know, even though folks may be talking about the accessibility of sexual and reproductive health care services on their website, abortion may not be listed on there as a service that is provided, even though it may already be, in fact, something that is provided, right? So some folks are not wanting to be really vocal about it, but students want to know. And that contributes to stigma, right? And the concern that young people have around the stigma around abortion. And that in turn will lead to concerns that young people have around how they're going to be treated if they come in for an abortion. Will I be judged? Will it be a welcoming space? Will people use gender neutral language when they're talking to me about an abortion or the procedure, you know? And so these are all the concerns that young people have, all really good things to think about as folks draft similar legislation to that of California, is the concerns that young people have and some of the barriers that are coming up for us right now. And another thing that young people were asking for is support. What support will I have access to if I need it after a medication abortion? And so something we're looking into is like, what do maybe doula collectives look like on campuses, right? Abortion doulas and things like that, so that there's that peer support. Something that's not on these slides, but that also came up is fear of protesters. And while we haven't seen that yet, at least and to my knowledge, we're not seeing that yet. Young people were concerned because they're seeing how hostile the antis are, and they've seen it. I know that when this bill was being passed, there was a lot of hostility from the antis, and so young people are concerned about that and just want to make sure that the environment that is created is safe. So that's where we are right now at URGE. Our students are really looking to work with the student health centers and do outreach to get the word out that medication abortion is available, that they're talking to their peers about this, that folks know what it looks like, what the process is looking like. And we're continuing to collect data on all of that. So really, we're focusing on building relationships, getting the word out, and continuing to listen to young people and bringing their concerns to the top, as well as bringing them to the table. Because they're really the ones who need to be leading the implementation and what they want this to look like. So yeah, I am looking forward to more questions as they come up from you all around advocacy around SB 24.
Thank you, Cindy. That was excellent and gave us such a good picture of what it actually takes to implement such a life-changing law on the ground and how to include students in the process. since you and Senator have just started on state policy, I think let's stay on the framework and thread here, and dive in a little bit more. I think a lot of the folks listening in today are going to have some hope, seeing that California is once again leading the way, is taking proactive action to provide reproductive justice and healthcare on campuses to their students. And there might be folks from other states wondering, can I implement this in my state? How do I translate this policy into other states where it might be possible? So I'm wondering, Senator, maybe I can start with you. Do you see this as a piece of legislation that could be easily copied or adopted to other states? Or were there, sort of some unique things going on in California that made this possible in the moment that it happened? And just to add, context, obviously, California has also been able to invest more in the public institutions in higher education and provide more adequate funding while it's a work in progress than some other states have been to support their students. So is that then a challenge for you that you think other states are going to confront? Generally speaking, how do you think it will play out across the country?
Well, thank you for the question. And as I said earlier, our hope was always that we could set an example in California and that other states would follow suit. And let's just be real. I think it's going to depend on the legislature. If you have a Democratic legislature who believes that women and students should have a right to choose and have an abortion, then I think it's going to be an easier task. I mean, it's a pretty straightforward bill, just saying that at your health center, you have to include medicated abortion, which, as I said, is simple, safe, and effective. So, it's going to depend on the legislature. And if you have folks that are willing to introduce the legislation, and always, 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 I believe that your constituency groups are so important. So finding students, the students were amazing through this whole process. Even when it first was vetoed, they came back, they're like, we're ready. And they're the ones who are like, we don't want to Cindy's point, to stigmatize abortion. And, they had t-shirts that said, say abortion, and really just, they led the way. And I think it makes it a little more difficult when it's not just a legislator saying, hey, we got to do this, but when you have actual students on campuses saying, we are demanding this service. We write a check to go to school here every day, and we want this service provided. So I would say having the students be involved, then also, unfortunately, I think it's going to really just depend on, if you're in a red or a blue state.
Thank you for that. And Cindy, just picking up on that comment about sort of students being at the center of this movement and wanting to have a role in play, not only seeing the legislature pass this, but then as you were talking about wanting to see it implemented with fidelity and equity on your campuses across the state. How do you see students' success so far with actually getting the colleges to implement this in the way that they are hoping in terms of the format? And you talked about the importance of privacy, but also being able to either obtain this via telehealth or at certain hours, depending on when the actual campus health facility might be open, the sort of logistics on the ground that really can make or break the policy implementation question. Are the students successful so far in making sure the campuses are hearing their concerns and having a plan to address all of them?
Yeah, that's a really great question. I know right now at this point where we've seen a lot of success is with the implementation and the training of providers. We know through our partners that there's been hesitation, right? There's often stigma. People feel a lot of different ways about abortion, and that unfortunately sometimes comes through when providing the service. And there's we've seen that our advisory board has had a big impact in the providers understanding why this service is so essential. One of the things that was done really early on is the students filmed a short video around why abortion on campus is so important for them and why they want to see this implemented in a way that's inclusive and in a way that's accessible. And this video plays at the very beginning of trainings for providers, and it really sets the tone around like why this is being done. It's being done for young people, it's being done for our students, right? And it's important that they have access, and these are the reasons why it's important to them. And so having those student voices at the table is a game changer. And we've seen it happen with the training of providers, and providers want to connect. We've heard from several student health centers that want to talk directly to the students, and they want to know, we're seeing protesters, what can we do, or what would be best for students to mitigate this, right? Or what type of trainings, like the students right now are in the process of building those relationships with the student health centers themselves. And as we build those relationships, they're sharing why it's important for them, for folks to be addressed in gender neutral ways, why it's important for schools to be vocal about this service and really destigmatize abortion. And so we're seeing it work. And where we've seen it the most right now is with the training of providers. And we're hoping that in the next couple of years, this is a marathon in ensuring that it's inclusive and that it's accessible. But we're hoping in the next couple of years that we're starting to make strides with making sure it's non-judgmental, it's inclusive, and it's accessible, which is really like a concern for us right now, is that we don't want students to pay for these services. We want them to be able to access it for free, right? That is the goal, through insurance, and if not, that they're not having to pay out of pocket. So I believe that we're going to make really good strides there because our students are passionate. And they will not take no for an answer. So they're working really hard on those things.
And Bruce, if I can just jump back in and also add that one thing that we said when we were shepherding this bill through, 5 years from now, this will be the new normal. People will look back and say, what? They didn't used to offer medicated abortion on campus. So it's always going to be a little bit harder in the beginning when you start something new. But again, as Cindy has said, and I'll reiterate, it's the students, and the students are the ones that are going to lead this. And we heard a lot about that when both times we were getting the bill through the legislature. The campuses saying, oh, we're worried about protests and whatnot. And you know what? If we worried about things like that through life, nothing would change. I come out of the labor movement, so I always tell people a good protest is nothing to be afraid of. And yes, people are going to protest, but we can't ever let that stop us from ensuring that our rights are not being taken away from us. So we will get through this. We will always be there to help the students, but they're the ones who are really going to lead this access. 5-10 years from now, people won't even think about the fact that there's medicated abortion. Just students will have access. And the other thing I always want to reiterate, this primarily affects young women. When we were doing this bill, we had so many young women come and talk to us. The one I remember the most was she, and most of them said, we were using contraceptives. People act like when you get pregnant, it's just because you're willy-nilly out there sleeping around. And if you want to do that, that's your choice. But most of these young women, their birth control failed them. And as one student told me, she said, I would lose my scholarship and I wouldn't be able to continue going to school because she played softball. And she said, and my boyfriend, he also was on scholarship to play. I think he was a baseball player. But there's nothing that happens. And I don't mean something should happen, but he could go on with his life and have his scholarship and get his education. And if this young woman was forced to carry this pregnancy to term, what are we doing to her and this baby because she doesn't get her education? So there's so many considerations. And I just say that because all the anti-abortion people have so much rhetoric out there, and we have to fight it with real stories of real people. Thank you.
Thank you, Senator. And just to sort of, before we go back to the federal side, just one final question, I think, for you, Senator, to close us out on the state side. Do you see this there being further steps in the legislature on this on the policy front? I know community colleges are not yet included in the legislation, and obviously they're relatively less, have less funding and maybe not healthcare centers on campus, or potentially there being legislation to address the cost issue.
Yes, the first bill we had originally included college campuses, but it's just a matter of them not having health centers. So many of them, there's over 100 community colleges, and they just don't have, so many of them don't have health centers on campus. But don't think that we're not thinking about how we figure that out, because I mean, my God, our community colleges see so many students, and personally, I would love to see that included in the future. So you start, and then you just go forward, and you make more change and do better things, and we will find a way to get the community colleges included. But that was the reason we took it out, is that they just couldn't logistically, most of them, do it. So but that's a problem too, right? Shouldn't all community colleges have a health center on campus, not just for a medicated abortion, but for other things that students need? So we still have work to do in California.
Wonderful segue. And of course, we also believe healthcare to be a human right and not a privilege, and a student basic need. So I want to switch over to the federal side. Thank you again, Lauren and Laurel, for giving us such a great overview of the things going on within the Biden-Harris administration in particular. Lauren, I know you gave us in particular great overview of some of the things going on at HHS, but if you had to pick out one single most significant thing, federal action step that you think that the administration could take to protect access to abortion for individuals across the country, but in particularly students in higher education, what would you say that one step might be?
Sure. So I think based on conversations we're having with partners across the country, as well as folks in DC, is making sure patient privacy is at the forefront of what we're thinking about. We are hearing stories from health providers, health information management systems. I think there is still a lot of confusion about what can be shared as far as it comes to protected health information and what can be protected. And so I think we definitely are looking to continue having conversations and doing education and outreach to these providers, to these management systems, so that they're following the HIPAA privacy law, but also having conversations with folks to see how we can bolster the HIPAA privacy protections.
It's such a great point, and it reminds us of other areas of student privacy where we've confronted when colleges are not quite sure how to respond to aggressive and unjust enforcement of either state actions or even federal actions, like happened under the previous administration when protections for undocumented students were rescinded in the DACA program, and colleges were wondering how they were going to respond to protecting student privacy and data. This is going to become even more important in the wake of the Dobbs decision, and protecting any information that the college might have on a student's healthcare decisions. So appreciate you sharing that. Laurel, since we're both congressional alums, I get straight to the Congress aspect of this. Here now, obviously, we've come up short in our ability to codify Roe in votes in Congress, and we have a filibuster in place that's blocking further progress, at least at this point, in the ability to re-enshrine the rights that were the case under Roe. Short of a repeal of the filibuster, do you see there being any prospect for Congress taking steps or being able to protect access to abortion care?
So I want to be really careful here because I'm wearing my C3 hat and speaking on behalf of the Federation. And there's obviously other efforts in place, but you raise a really good point about the composition of the Senate and the support for abortion rights. Right now, we have 47 senators who have signed on to the Women's Health Protection Act and have voted in favor of it. And obviously, we need more. We need more votes on that particular piece of legislation, and which is, really the guiding post that I see right now for abortion rights. I know there's a lot of other conversations that are happening, and you certainly see a lot of efforts, especially coming out of the House. The House has taken a number of steps and has passed a lot of bills after Dobbs, both as relate to abortion access, but also as relate to birth control access, and as relate to the right to gay marriage. So you're really, seeing a lot of places where we need action from Congress. And, to your point, Bryce, it is much easier to count to 50 than to 60. But we are just working day in and day out to make sure that people realize how popular support for abortion rights are and how important it is, that it shouldn't matter if you're a student who is from California but has, for whatever reason chosen. I personally went to school in California, so I don't, apparently people decide to go other places as well, but it shouldn't depend on whether you are currently living in California or living in Mississippi, whether you have access to basic healthcare and to your fundamental rights. So we will continue to push on getting that support in Congress, and finding a path. To your point that, filibuster is certainly a barrier right now, but, in reality, we got 47 votes when it came to the Women's Health Protection Act. So we need to get more support anyway.
Thank you. And Lauren, I want to ask too, maybe this will probably be our final question for this Rockstar panel here, bringing it back to student involvement and how they can, students across the country can express their voices in federal policy making. You mentioned that there's a current public comment opportunity. Either if you want to expand on that, or are there other opportunities that students in higher education and the faculty and staff that try to support them on their campuses can get involved in federal policymaking or enforcement efforts, and make a difference? And I think this might be particularly important for students who are in banned states, to be able to get some help from federal government and protect their rights.
Sure. I really love that question. So when I was in Mississippi, I got involved by founding a chapter of Law Students for Reproductive Justice, which is now, I think, called something else. But, it's really great that you have that energy, that you want to get involved. I think a lot of times what we're, as federal policymakers, we don't hear enough from the people we need to hear from. So that includes y'all who are here today. We need to really hear from impacted communities, not only about what they want to see happen, but also how we are doing and how we can improve, right? Because we may say, like, this is the guidance that we put out, this is our proposed rule. But if on the ground it doesn't work for folks like Cindy, Connie, others, then we need to know that, and we need you to send that information to us, right? So you can do this either through commenting on the Federal Register. You can do this by emailing us. I do have an OCR email that I'll quickly share, and then Bryce will share with you if you want to follow up. But it's OCRmail, so OCRmail@hhs.gov. So definitely reach out to us this way. We're happy to meet with folks. We're happy to hear from you. Student voices, like Cindy said, are really at the center to make substantial changes. As a young person, I was working in Mississippi to defeat a personhood amendment. And so I just got on the phone and started calling people, started knocking on doors. And while maybe that's not what you can do at the federal level, you can definitely do it at the state level. And as far as filing complaints and getting involved with enforcement actions, I think sometimes, maybe you don't realize that discrimination has happened or that your privacy rights have been violated. So, definitely try to educate yourself on that. We have a lot of good resources on our website, but also file a complaint. You're not going to lose anything by filing a complaint. You're going to inform us of something that's happened, and then we will have the opportunity to review it and decide whether we can investigate it or not. So don't be afraid of that. There's never any repercussions there. And you can also file that on our website, but the website for that is ocrportal.hhs.gov. And we want to hear from you because we need to know, and we need to be pushed, right? Like Laura was talking, she's trying to push us. We need you to push us too. So that's why we need to hear from you.
Thank you, Lauren. And you heard it straight from her. We have to be forceful in representing the needs and interests of students. I want to thank again the incredible panelists for this conversation on a really urgent national issue. And I'm particularly glad we could explore both the federal and state aspects of the fight for reproductive justice for students in higher education.